Hi, I'm Dr. Amie Bend, and I was demonstrating today. I'm demonstrating how to use a fascial device to help us restore circulation and blood flow to our limbs. It's a complement to your chiropractic care. In fact, it'll even help take you maybe further than where we're able to get with just adjustments. So I have a device I bought on Amazon. It's not the only device out there. This one I like for my patients because it has a roller on it, but you can also use it. I put a rubber band on it to make it more less mobile on the lowest, on one of the end units or end cylinders. So what I want you to do for a neck patient is I want you to roll onto your trapezius muscles. And again, as I mentioned earlier on an earlier video, when the roller is engaged, you don't need to have any oil or anything on. You can just roll up and down and get into your muscles and just release some of the tension in your trapezius and your sternocleidomastoid muscle. But when you get closer to around the neck area, the skull area, I should say, you may want to use, and that's why I put the rubber band on there, just to have it to be more of a stiff range of motion. That being said, you may want to put some oil around the areas where you're going across the muscle, and you're basically trying to rub out some of the tension that's in the actual fascia underneath the skin. So that being said, this can also be utilized across your back in the direction of the muscle that's there. So I've got a short sleeve shirt on, and you can go in and start going across where your trapezius muscles are and really hit the knots. And then you may want to turn your head and utilize that. It is more comfortable when you have oil on it. So I have magnesium chloride. I may also put on almond oil and magnesium chloride, or just any type of oil. Some people just use mineral oil. You can use any kind of oil that you have that's skin safe. You may also roll on it back across the trapezius well, but I'm finding that when we go at an angle, it really gets into the trapezius muscle. So then you can go across the back, under the axillary area, underneath your arms, and rolling, or you can tighten your muscle and go back and forth, getting onto the tricep area. And what this does is it just releases the fascia, which then it sort of hurts a little bit, but then it feels better when you're done. And it feels kind of good when you're doing it if it's not terribly tender. My muscles are stronger in my upper extremity than my lower, so I've rolled on these quite a bit and I haven't gotten any bruising from it, and it's probably just because it's just used more. So I don't use as much oil for the upper extremity, but you may find that you want to use the oil. And what it'll do is it'll help release the fascia, get more circulation, and may help you with your arm pain. I also use it for my wrist. I find that when I work my tricep, my wrists feel better, and then I'll go in and rub out the forearm, and I'll go all around. Okay. And it hurts a little bit, but it's not terrible pain. It's just feels like I need to release the tension in the area. So you can roll on it again, then you don't need any oil, but if you want to use the stiffer use of it, and you roll across, you don't roll across, you just go across the muscle, the belly of the muscle. You might have some areas that are tenser than others. I've got a nice tense spot here on my ulnar side, my ulnar bone, and that sort of hurts. And you do it till it's red, and then you just get off of it. And then that's when I like to use my herbal freeze after I've been doing this, and I might want to put that over the top wherever I was rubbing out the muscle. So this is just another way you can use the fascial device. Again, this is the one, I got this for around $20 on Amazon. I'm sure there's more than one. I may even use a different type of fascial releaser in the future. But for right now, this is perfectly good for some of my patients that are trying to release fibrous adhesions and tensions that are in their neck area, shoulder area, and even in the arm. If you have any more questions, give me a call. I'm at Arroyo Grande Chiropractic. My number is 805-474-4747.